Donaldson is going to be a little late this morning, so I'm going to run the meeting until he gets here.
Oh, there it is.
Yep, it's okay.
Pass it on down.
Okay. So, again, good morning. I call this meeting of the June 25th Board of Health meeting to order. So we'll do member roll call. As I mentioned, Council Member Dave Donaldson, our board president, is going to be running late this morning. He should be here in about 30 minutes. And I'm present, so Commissioner Geithner. Here. Commissioner Corey Applegate. Not here yet. Dr. Richard Vu.
I'm here.
Dr. Deborah Chan.
Present.
Hunter Barnett.
Here.
Okay, thank you. Now we'll do the approval of the agenda. We need a motion and a second.
So moved.
Commissioner Geithner moved.
I'll second. Deborah Chan.
Dr. Chan seconded. All those in favor?
Aye.
Aye. Motion passes. Are there any Board of Health comments? Seeing none, we'll move to the next section, approval of the minutes, the April 23rd, 2025 Board of Health minutes. Are there any questions about those minutes? If not, we need a motion to approve and a second.
I'll move to approve.
Dr. Deborah Chan moves to approve those minutes.
I'll second.
Hunter Barnett seconds the approval of the minutes. All those in favor?
Aye.
Aye.
Motion passes. Okay, are there any public comments not on items not scheduled on the agenda?
There are no public comments at this time.
Okay, thank you. No public comments. Okay, so we're going to do some recognition this morning, and it looks like Glant Havnar is not here yet, but we wanted to recognize her service on the board, and I think Deanne's got some remarks.
Thank you. Good morning. As you may be aware, Glant Havnar has resigned her position as the mayor of Palmer Lake, and we will be seeking to fill that position within the Board of Health. We had hoped to have Glant here this morning so we could recognize her service to the board, and she may still join us, but I wanted to take just a moment to express appreciation for the time and tenure Glant has volunteered to our board. Glant joined the board in February of 2023 and has served on our board through that time, representing an important seat within the board, bringing the perspective of municipality outside of the Colorado Springs municipality to the board, and helping bring a broader perspective to the board regarding the services we provide for all of El Paso County. So we're certainly grateful to her service on the board and thank her for her service, including adding her voice to support for youth in our community, and as we've all heard from Glant at various meetings, her support for the importance of supporting mental health in youth, and also concerns for bullying and other substance use issues amongst youth as well. And I'd also like to thank her for her service. One of the notable things that occurred during Glant's tenure on the board was fee revisions for our environmental health fees. And in fall of 2023, Glant was a part of working with industry as well as our subject matter experts within environmental health to bring forward a new fee schedule for environmental health, participating in those administrative hearings. So I'm grateful for her service to the board, and would like to offer those words of thanks.
And then thank you so much, Deanne, and I'd like to express my gratitude to Glant. She was an amazing Board of Health member and very committed during her tenure, so I want to add that. Anybody else want to speak to Glant? No? Okay, thank you. Okay, next on the agenda is the proclamation recognizing the retirement of Marini Labor. And I think our El Paso County Attorney, Lori Seago, is going to read that proclamation.
Proclamation recognizing the retirement of Marini Klaber, El Paso County Board of Health. Whereas Marini Klaber began her career with El Paso County Public Health, or Public Health, as an environmental health specialist in 2005 and served the majority of her career as the regional epidemiologist for the South Central region, which consists of El Paso, Park, Teller, Chaffee, and Lake counties, culminating in her promotion as the Communicable Disease Program Manager in June 2023. And whereas, under Marini's leadership, the Communicable Disease and Emergency Preparedness programs have celebrated several notable successes, including the creation of the Colorado Epidemiology Conference in 2016, the successful management of the Epidemiology and Laboratory Capacity Grant, and the effective facilitation of the Health and Medical Emergency Support Function 8 in response to the 2015 Planned Parenthood shooting. And whereas also during Marini's tenure, she served as a mentor to all communicable disease staff, providing training, support, and guidance. And whereas through the COVID-19 pandemic, Marini served within the incident command structure and created strong partnerships with community partners, including law enforcement, the Criminal Justice Center, and Springs Rescue Mission, with a commitment to practical and empathetic response. And whereas, while serving as the regional epidemiologist, Marini provided leadership and training to staff in Teller, Lake, Park, and Chaffee counties, in addition to El Paso, supported the responses to a nationwide salmonella outbreak and the introduction of terrestrial rabies in 2010, and published a journal article on estimating the attack rate of pregnancy-associated listeriosis during a large outbreak in Colorado in 2015, in conjunction with the Centers for Disease Control. And whereas Marini's commitment to partnerships, a common-sense approach to public health practice, and community service has created a strong foundation that will have lasting impact to public health and the state of Colorado. Now, therefore, the El Paso County Board of Health hereby proclaims its gratitude to Marini Klaber for her 20 years of service to El Paso County and wishes her the best in retirement. Moved, seconded, and adopted by the El Paso County Board of Health at its meeting held on June 25th, 2025 in Colorado Springs, Colorado.
Okay. I would like to invite comment from any of the board members, Board of Health members, and then I would also like to thank Marini for your 20 years of service. It's commendable, and we appreciate you, and we'll miss you. Anyone else would like to comment? Deanne?
Thank you. I would be delighted to add some comments regarding Marini. It is always bittersweet when we have a team member of 20 years who has been a part of so many different response efforts, so many different activities over the course of her 20 years. Well, we're happy for Marini to be able to explore the next chapter. We will certainly miss having her here as part of our team. As noted in her resolution, Marini has been part of every public health response over the last 20 years, some of them more impactful than others, some of them more complicated than others, and something that I appreciate having Marini as part of our team is no matter how complex the situation is, she's always demonstrated a commitment to doing the next right thing and thinking forward about how we can achieve benefit to the El Paso County communities we serve. Also reflected in her resolution, I would like to note that Marini has been a linchpin in so many important partnerships for public health. During our COVID-19 response, Marini was our primary point person to support the Criminal Justice Center and worked so closely with El Paso County Sheriff's Office during that period. And I think it is worth noting that in appreciation for that work that she did with El Paso County Sheriff's Office, she was honored with a Civilian Achievement Award from El Paso County Sheriff's Office. So very pleased to have Marini receive that recognition for her tremendous partnership. And then on a more personal note, I would just like to express my gratitude for Marini. When I joined public health in 2015, I joined as staff within the Communicable Disease and TB program. And like so many other people who have joined that program, Marini was a tremendous part of my onboarding and my training, and I value that very much. And it's a wonderful thing when you're starting a new position to have a mentor who not only challenges you, but also empowers you with skills and tools to be more effective in your role. And not only for myself, but for so many other people in our agency, Marini has been that person over the last 20 years. So you will definitely be very missed, Marini, and I know our entire team thanks you for your years of dedication to El Paso County Public Health.
Thank you. Are there any guests or in the room that would like to come up and comment? Okay.
Hello, I'm Janelle McNair. I'm currently the Acting Division Director for Disease Prevention and Response. I'd like to take a moment to congratulate Marini on an incredible 20 years of service. As you heard in the proclamation and by comments made by Deanne, her list of accomplishments is long, meaningful, and truly impressive. But the piece that I want to highlight for you all is her work with the Emergency Preparedness and Response Team as a regional epidemiologist. In that role, Marini supported the South Central region, covering El Paso, Park, Teller, Chaffee, and Lake counties. Marini earned deep respect from our rural partners for her responsiveness, her subject matter expertise, and yes, her admirable willingness to answer the phone after 5 p.m. on a Friday. Because we all know disease outbreaks have impeccable timing. Over the years, she supported countless epidemiological responses, led tabletop exercises, facilitated regional meetings, and helped build long-standing, trusted partnerships with local public health agencies across the region and the state. Her work laid a foundation that others will benefit from for years to come. On a personal note, like Deanne, Marini was also part of my hiring team as well. I feel incredibly fortunate to have worked alongside her for the past 10 years. I've learned a great deal from her mentorship, appreciated her ability to blend sharp insight with just the right amount of sarcastic humor, and consistently admired her calm professionalism through some trying times. Marini, you've made a lasting impact not only on the El Paso County Emergency Preparedness and Response Program, the Communicable Disease Program, but also the South Central region. And all of us are lucky enough to have worked with you. We wish you all the best in the next adventure, and may it include fewer Friday phone calls and more time for everything that brings you happiness. So congratulations.
Thank you. Anyone else? Dr. Vu?
Mary, I also want to thank you and thank you for serving the underserved. Thank you.
Marini, would you like to say a few things?
Well, I didn't prepare anything, so thank you so much for all the kind words. It has been my privilege to serve this community and this agency. I am so glad that, that I've been able to touch so many lives, and I really feel privileged to be here today with you all. Thank you.
Thank you. Thank you so much. So we're going to do a photo, right? A photo op?
We do need a motion
I'm
to
sorry,
actually
okay.
approve the proclamation.
Sure.
Please.
Okay, so is there a motion to approve?
If I may also add a comment before
Sure.
I make the motion, I just want to also add my thanks. It's always hard. I know at the county, anytime that we lose anyone to retirement, I will say, but also it's such a joyful time as well, because I know that we all wish you well and hope that you just have all the time to do all the things that we just often don't have time to do in life. So wish you the best. And with that, I will move approval of the proclamation.
Commissioner Geithner moves approval. Second?
Second.
Hunter Barnett seconds. All in favor?
Aye.
Opposed? Motion passes. Thank you. And then also Commissioner Corey Applegate has joined us. So we'll note that. Okay, so the next item, now we're going to do the photo, right? Yep. We usually don't, yeah. Okay, so if the Board of Health can come up and we'll do a photo.
Great. A couple here. Me, 1, 2, 3. 1, 2, 3. And just for good measure. 1, 2. Thank you.
Okay. Next on the agenda is the Annual Comprehensive Financial Report. Nikki Simmons, El Paso County Chief Financial Officer, and Debbie Perry, El Paso County Finance Division Manager.
Good morning, Board of Health members. I'm Nikki Simmons. I'm the county's Chief Financial Officer. I am excited to be here this morning to present to you the results of our 2024 financial audit for El Paso County Public Health. And before I pass it on to Ted Williamson, who is a partner with our Reuben Brown, the firm of Reuben Brown, who's our auditors out of the St. Louis office, I just want to express my sincere appreciation to every member of Public Health. This audit is not just something that is done by the finance division. It is something that every single member of Public Health somehow touches one way or another through whether it's cash collections or billings or grant compliance, say eligibility in a women, infants, and children event. Every member of Public Health somehow touches this. And so I'm not going to steal too much of Ted's presentation, but I will tell you we have a clean audit. Very excited to not have any findings, no adjustments to the financial statements. I also would like to directly, in my office, share appreciation with Debbie Perry, who is our Finance Division Manager, and Jody Pinnell, who's the Accounting Manager, who oversees the preparation of this ACFR and the audit and does all of the coordination on your behalf. And they did an excellent job this year. As you're fully aware, we have a lot of funding scenario changes, a lot of grants that we comply with, and they're involved every single day and every minute of getting that done. And this is the audit of those results. And so if there's any other questions for me, or I'm happy to pass it on to Mr. Williamson.
All right. Thank you, Nikki. Good morning, everyone. Again, my name is Ted Williamson. I'm a partner with the accounting firm of Reuben Brown, and we did the audit of public health for 2024. So the audit involves two parts. There's the audit of your financial statements, or the annual comprehensive financial report, as it's called. And then there's what's called a single audit, which is a compliance audit with the over the federal awards that you receive. So I'll talk about each of those in turn. The financial statement audit, which you've got a copy of it in front of you, the purpose is to determine that your financial statements are fairly stated in accordance with accounting principles. Those financial statements are used by citizens, regulators, et cetera, to evaluate the financial performance of public health, so it's very important that they be presented correctly. Public Health as a governmental entity follows the standards of the Governmental Accounting Standards Board when doing their financial reporting, and then we do our audit in accordance with the audit requirements of the American Institute of Certified Public Accountants, as well as the Government Accountability Office of the federal government, because of the level of federal funding that you receive. As Nikki mentioned, I'm pleased to report that we did issue what's called an unmodified or a clean opinion over your financial statements. We also did not identify any adjustments that had to be made to the financial statements, which is really good. It's not uncommon on an audit of this size to at least have some corrections that we identified. So the fact that we had none was very good. And we also did not identify any of what we refer to as material weaknesses or significant deficiencies in internal control as part of conducting the audit as well. So everything went very smoothly. We did not have any difficulties in performing the audit. As far as the single audit, which is the grant compliance piece, during 2024, Public Health expended $22.6 million of federal funds. Now, we do not have to audit every program every year. Instead, the federal government has a formula that we have to follow where we are to focus on either the larger programs or the programs with the most risk involved. So for 2024, we looked at 3 programs, which were the American Rescue Plan funds, the CDC Collaboration Grant Program, and the Immunization Court Services Program. And again, we're pleased to report we did not identify any instances of non-compliance or any internal control issues when auditing those grant programs. So very good results. Very soon, your financial statements and single audit will be submitted to the federal government via their clearinghouse website, and that is a public document, so it's very nice, being that it's a public document, to be able to submit an audit where you have no findings. So that's what I have to tell you this morning. I'm happy to answer any questions you might have.
Questions for Mr. Williamson? I'd just like to thank the whole team at Public Health for the work, because without the team effort, this wouldn't happen. And so it just shows how qualified our team is and conscientious they are. So thank you to the El Paso County Public Health staff, all of them. Commissioner Geithner?
Yeah, I don't have a question, but I do also have a comment, which is also just thank you to the entire staff. I know that's quite a rigorous process, and it's great to see that there are no findings. So again, thank you to the whole public health staff, and also Nikki Simmons, who I know is a huge part of all of this every year. It's always tremendous to be able to say that we have those clean findings and look taxpayers in the eye and say, you know, we're doing the right thing. So thank you.
Thank you. Any other comments or questions? Okay, well, thank you, Mr. Williamson, for your time today.
All right, thank you.
Thank you. Next on the agenda is the finance and budget with Lauren Mearmount.
Hi, it's Lauren Miramont. I'm the budget manager for public health. Is there a slide? Thank you. First of all, I just wanted to point out some information in this slide for changes. It's the second column to the right. That reflects a grant that was approved at the April meeting for suicide prevention. And so anytime the board adopts a resolution to change the originally adopted budget, that will be reflected in this column here. So I just wanted to point that out for context, that information has been reflected in this information. And then as far as our financial status as of May 31, we are on target for our El Paso County funds revenue for the year. Same thing with our state LPHA funding. Those are coming in right as expected. Our program-specific grants are trending higher for this point in time. And just to bring your attention again, the first column that says budget, that's actually a trended budget based on prior year data, not the actual originally approved budget. It's just informative for where we're at with the year, but we are trending a bit higher with our program-specific grant revenue for the year, and that is a result of us trying to close out our June 30 grants. Our licenses, fees, and permits revenue is also trending higher for the year, and that is a result of our increased fees and also improved processes and collection of those fees. Our Medicaid fees and insurance is right on target for the year. Our interest income is trending lower than budgeted, and that is expected to continue through the year, but that's just based on economic conditions, and is a very small portion of our overall revenue. And then our contributions, donations, and miscellaneous revenue is on target for 2025 as well. Regarding expenditures, our personnel budget, again, based on trended data, is lower than we were at this point in prior years, but we are on target for our budget for 2025. Our operating expenditures are trending a little high at this point in time based on prior year data, but also on target for 2025. And then we're done with our capital expenditures for the year for the south building. So that is not expected to change for the rest of the year. Are there any questions?
Questions?
My question about operating expenditures, what primarily accounts for the variance?
So the budget in the first column is based on 3-year prior trend data. So just at where we are at this point in time compared to prior years. But if you look up the total actual operating expenditures to our budget, we are actually under budget at this point in time for 2025. But it is based on timing. So we did have a large expenditure in operating in May that was just paid at a different time in prior years. So that's what that is.
Other questions? Commissioner Geithner?
Yeah, I'm curious about the interest income because so many of the other organizations that I serve with are seeing an increase in interest because of interest rates being high. So I'm curious, what do you think is affecting that?
So I didn't develop the budget for this item, and I do feel like the interest is reflective of the current economic environment, but maybe isn't matching up with what we anticipated that it would be for the year. But I can certainly look into the backup information
Commissioner
more.
Geithner, I might be able to address that question because I actually questioned that last year when the projected interest income had risen, but our what do you call it when you have that large amount of money that you set aside?
Reserves?
Our reserves, yes, thank you. Our reserves had gone down. So our reserves had gone down, and the interest rate had actually fallen compared to 2024 and 2023. And so my question towards the end of 2024 was, how could you project a rise in your interest income under those circumstances? And the answer that I received at that time was that we had underestimated our interest income for 2023 and 2024, and this was just a projection that sort of right-sized the interest income. But it turns out that probably wasn't the case because of the decrease in our reserves and our and the interest rate. I think that could have been projected, but it was not.
It's a small amount. I don't think it's, incredibly consequential. I was just curious because, economic conditions are a part of that, but generally it has, it's very specifically tied to what those interest rates are. I know there's a lot of pressure right now to lower interest rates, and so we could see that, if that happens, obviously dip down a bit further under the projection, but of course that's very difficult to predict. So just curious, and it's interesting, and I understand that you were not part of that process. So thank you for sharing the questions that you asked previously. And I just want to point out one other thing. Obviously, on that line item, you have a considerable amount of funding from El Paso County. I want to thank Dan, actually, who probably inadvertently alerted. I asked some questions around what the statutory requirements and statutory functions for public health, and I think it was in some documentation actually that you shared with me that I caught that there is a requirement to submit certain things to the county commissioners because we do have such a large portion of that comes to public health. So I think we'll maybe have some more comments. I don't want to get too deep in the weeds on that and surprise anybody here, but I'm really curious to continue that conversation. And for the board's awareness, these are not statutorily required dollars for the county. The amount that we are actually required to send to public health is considerably lower than that. So that has been an over and above, which I think is a good thing. But I do think over the last several years, there has not been a lot of clarification to the Board of County Commissioners on exactly what all those things are and what the benefits are to our community. So I really look forward. Deanne has done a really fantastic job of trying to help clarify some of this for me in particular. So I really look forward to us continuing to have those discussions and understand that that relationship with the Board of County Commissioners And having commissioners understand the value in those programs is incredibly important to making sure that we continue to have the levels of funding that support what public health wants to accomplish. So look forward to more of those conversations.
Thank you. Dr. Vu?
Thank you. I just want to also express appreciation to the county commissioners for financially supporting our board, and I do agree we need to be held accountable also.
Deanne, do you have any comments? No, okay. Any other comments? Okay, well, thank you so much,
you.
Lauren. Okay, next on the agenda is the renewal of previously approved contracts. Deanne?
Thank you. Our June meeting is always a very full meeting, as this coincides with the state fiscal year, and many of our contracts come before the board for approval at this meeting. So on today's agenda, you have 11 contracts for which we are seeking board approval. All of these contracts represent service contracts that have previously been approved by the board, and there are no new funding streams coming on our state fiscal year. And I'd like to just add a little context as we go through these contracts. Within the framework of governmental public health, local public health agencies often serve as the service delivery arm of governmental public health. So the contracts that you see today represent state and federal funding for services where the scope of work has been established at the state level, and as the local public health agency, we are provided with the opportunity to accept service contracts to deliver within that prescribed scope of work. So with that, we have sent out information in May regarding these contracts. One thing I will note is that when we initially sent that information in May, we were anticipating having 14 contracts in front of the board today. As we are experiencing some delays in contracts, 2 of those contracts we had to remove. One was the Public Health Emergency Preparedness Contract, the other the Cities Initiative, Cities Readiness Initiative funding. Both of those funding streams are federal dollars that are allocated to the state and received by El Paso County Public Health to support our emergency preparedness and response team. It's our understanding that the notice of funding has been delayed, and the state has not yet received that, so they were not able to release these contracts in a timely manner for us to be able to approve them. So we do have a no-cost extension on those contracts, pending the release of updated contracts. However, there is no additional funding for that extension. So we are hopeful that we'll have contracts in July, and that may necessitate a unscheduled meeting of the board in July to be able to approve those contracts. So following this meeting, Amanda Hamilton, as our board liaison, will send out a calendar hold for a potential meeting following our typical cadence in July. We anticipate offering that as a virtual meeting solely for the purpose of being able to approve that contract should it come forward in a timely manner. So those are delayed, and I appreciate the support from our county team as some of those delays, we had concerns as well because this is such a critical function of our team, and especially in the context of a measles response, our emergency preparedness and response team is really a backbone when we have to respond in the community. So I'm grateful for Ryan Parcell and Brandon Wilson at the county who have helped us work with the county team to understand and communicate with our federal lobbyists about any insights they may have regarding the cadence of the federal funding as well. So we continue to follow up on that. Also, our immunization contract is in a similar situation where the state funding is being released, but we do not yet have a notice of award on the federal component of that funding. So we will provide you with an update on the extension for that during the director's report, but we do not have a contract to bring forward for a vote today. And I would just pause there to see if there's any questions or concerns regarding that update before we proceed.
I don't have any questions. I just want to thank you for preparing the contracts as you did, the information on it, because I think the format is very good. It makes our understanding, at least my understanding of it, much clearer, and is likely to streamline the entire review and approval process. So thank you to you and your team for taking the time to do it in this format.
Okay, Commissioner Geithner.
Thank you. Dr. Chan beat me to it. I wanted to also say thank you for the preparation work that went into that. I know that that takes some time, but I agree that it gives us a much better picture than maybe previously I've seen, and it is tremendously helpful, particularly to see what those matching dollars are and compare that to what is valuable for the organization. So I really appreciate that. Is there any indication, I know that you specifically talked about delays on those other ones coming forward. Is there any indication with the ones that are presented in front of us today that there could be any changes related to funding changes?
Thank you. First, I'd like to say thank you for the positive comments regarding the work of the team. I greatly appreciate that, and I would like to thank everyone who worked on that, because our team really wanted to bring forward this information with as much clarity and insight as we could to the board, and I'm so grateful for the work that our entire team put into that. Regarding our additional funding streams, I think, yes, there are concerns that some of the funding could still change depending on what happens at the federal level. It is our understanding that the State Controller's Office is being very cautious, which is also part of the reason we're seeing delays in our contracts, in waiting to send out contracts until they have a notice of funding and some level of assurance that the contracts they are releasing will be able to be implemented. So that is some of the delay. And then also moving forward, as the federal funding moves forward, we may see adjustments to some of our contracts. We don't yet know what some of them, including Title X and immunizations, may receive ongoing. So we continue to monitor that and receive updates from the state. We'll continue to connect with county partners as well to monitor that. And I think this will be a theme of our funding over the next several years as we go through various cycles of contract updates and adjustments to hopefully arrive at a state where we have a clearer picture of our ongoing funding. So there's a lot changing in this environment, a lot changing very quickly, and I'm very grateful for the work of our team, our in-house budget manager, Lauren, our county budget partners who are helping us navigate all of this.
Okay, and I would just like to say good morning to everybody. I'm a little bit late. I was over at the State of the Utility address. It's only an annual thing. They scheduled it today. They didn't ask me first. It got scheduled, so I really wanted to be there to make a few comments and introduce the CEO. So I saw one of our county commissioners' colleagues over there. Commissioner Wysong was there. So, I hate to miss any part of this today. I know this is a very important meeting. So, but with that, I think I know where we are. Why don't you help me out, though?
Certainly.
Deanne.
We're just starting with our 11 contracts. So if you would like, I'd be happy to proceed to the core services funding.
Okay, yeah, please do.
Okay. The first contract you have before you is our public health core services funding. And this funding was formerly known as our state per capita funding. It's allocated through the long bill and provides funding for core public health services and capabilities. And regarding the definition of those core public health services and capabilities, I would just like to point out that in your monthly director's report that you receive, we have organized that director's report to match these core services and capabilities. So regarding how we deliver on those core services, our monthly report to the board is designed to help facilitate information regarding that. This is funding that is really crucial to our agency as it represents one of the sources of flexible funding that we have. So this funding provides core support for some of our services that are mandated but either unfunded or underfunded, such as our communicable disease and emergency preparedness response when we need to have more staff assigned to these areas. This provides a flexible backbone for us to be able to do that, and it is critical to our ability to deliver services and respond rapidly in the community. And we're very pleased to note that there was a minimal change to this funding in the long bill this year. This was certainly one of the items that was looked at by the Joint Budget Committee, and our funding remains relatively stable in this area. And I would be happy to answer any additional questions regarding our core public health funding.
Okay, and I believe the idea here is we'll go through these first four. We're going to have questions on each, and then we would vote on these first four. That's kind of a recommendation as one. These should be the most agreeable of them all. So, but we can vote everyone individually if board members want to do it that way. I'm fine. It was just a way to move things along. But Dr. Chan, did you have a question?
Only question I have is, do you know how much the population of El Paso County increased from 2024 to currently?
I would have to look that up. I don't, off the top of my head, have that figure for you.
Okay.
I'd be happy to provide that. But certainly within the context of the entire population change each year, the similar bucket of funding is distributed differently. So the minimal change of $1,000 within this funding is a minimal adjustment.
Because that's usually per capita funding,
Yes,
right?
yes,
Okay.
yes.
In general, I think the population is about 750,000 for the entire county, and I think the change in population was ballparking 4,000, 5,000, something like that. Something like that. Yes, Commissioner Geithner.
Yeah, and I know we're, in terms of population distribution, we're seeing a decline in a lot of areas around Colorado. So I assume that even if that bucket is the same amount, we're in good shape, at least in regard to that, because we are not one of the locations that are shrinking. I think this is, and to answer your question, I have no problem with voting on these. I don't think in a block unless there's something really, that pops up as we are going through them. I really appreciate having all of the materials far in advance so that we could get through those. But I also just want to state kind of generally for this board, because I know not everyone follows the state legislature super closely, but this is, I think it's good to your point that there was stability. But we know that may not be the case in upcoming years because there's a real budget issue at the state. There's a structural budget issue. And so I think that's really key for us all to just be aware of, that there's a lot of problems brewing with the Joint Budget Committee. And I know that, the county has seen impacts. I would guess the city maybe has seen some of those impacts as well. So for this year, I think this makes total sense, but we need to just all be aware that there's a lot of issues brewing at the state in terms of stability with the budget. So.
And thank you, Commissioner Geithner. Well said. Any other comments or questions about this specific contract? And I did not thank, I guess it's the Vice President, Doris Ralston, for taking care while I was not here. Thank you, Doris. Okay, why don't we move on to the next one, Deanne?
Thank you. The next contracts are held within our community health promotion team. Our division director, Daisha Hudson, is joining us remotely, and I would like to invite her to review the next contracts, and for her team who is present in the room with us, if you could join us at the podium, please.
Good morning. Thank you for letting me join you virtually today. Again, my name is Daisha Hudson. I'm the Community Health Promotion Division Director. I'm going to be presenting first the Child Fatality Review Team. The contract is for the Child Fatality Prevention System grant. This funding helps support us in fulfilling our statutory requirement of the Colorado Child Fatality Prevention Act. And so it helps us support the organization and facilitation of that team in reviewing injury and violence-related deaths among 0 to 17-year-olds here in our community. There is a slight reduction in the funding compared to last year, and that's due to a decreased number of child fatalities. So that's actually a really good thing. We're happy to see that, but that is the reason for the reduction.
Okay.
Any questions on that one?
And I don't believe we have anyone online today. Is that right? I don't think so. Okay, any other information on that one, Deanne?
Not at this time unless there's specific questions.
Okay, why don't we move on to C, which is impaired driving.
Okay. The next grant is our community-based impaired driving prevention grant. We are currently in year 3 of a 5-year funding cycle. There are no changes to our contract or deliverables. However, there is a slight reduction in funding similarly to the child fatality review team. We're seeing a reduction because there was a decreased number of minor in possession citations and convictions. So that's a good thing. And the program goals for this funding are to promote community health by reducing fatalities and injuries from impaired driving crashes, and supporting traffic safety and substance use prevention efforts to encourage sober driving. And this is really done with an evidence-based model, so implementing evidence-based strategies in the community with our community partners to raise awareness and change attitudes towards driving while impaired, and with a focus on our young drivers.
Okay. Any questions? Yes, Commissioner Geithner.
I do have a question. As I said, I really appreciate the preparation of this, but under the percentage of program funded by grant, is that it requires a 50% match, or is that the program as budgeted, this is covering 50% of those costs?
So this grant covers 100% of the impaired driving program, but 50% of the FTE that goes toward it, and the grant does require at least a 0.5 FTE to fund the grant.
Okay, thank you.
Any other questions? Then looks like questions were answered, and we think we can move on to D, Tobacco Education and Prevention Partnership.
Thank you. So this is our Community Tobacco Initiatives grant. We're currently in year 3 of the current 3-year funding cycle. The funding has remained the same. Our program goals are to help adults and youth quit tobacco. We also want to prevent youth from ever even starting tobacco, because we know it's so hard to quit once you start. And then the third major program goal is to decrease exposure to secondhand smoke in our community. Our expected outcomes are to decrease tobacco use over time by youth and adults, decrease exposure to secondhand smoke in the community, decrease the number of tobacco-related diseases, and engage our community partners with evidence-based tobacco control efforts. So this is an evidence-based program. We are implementing evidence-based strategies out into the community and with our community partners as developed by the state tobacco prevention program.
Okay, thank you for that summary. And are there questions, comments from board members?
Are we able to vote on this contract before it's received?
I will defer to Deanne.
Yes. So for today, before we sign these contracts, we are seeking board approval to be able to accept the service contract under these areas. These are all previously approved contracts in renewal cycles. So they have previously been approved, and we are coming before the board requesting approval to continue the effort. Does that answer? Did I misunderstand?
Well, I'm not sure. So most of the ones that are, say, in a 5-year cycle, the contract for the current year has already been received, right?
The state fiscal year begins July 1, so we are in receipt of the contracts starting July 1 and seeking approval to execute those contracts.
Okay.
Because they follow the state fiscal year from July to June.
Okay, so do you usually receive the contracts in advance of the start of the fiscal year?
Yes, so many of these we have received, some of them as recently as a few days ago. So in this period, the state, starting in June, is releasing these contracts to us. We usually get to see information about the budget, the scope of work in advance of the receipt of those contracts. So this is a very fluid period for us where the state releases those contracts. We generally receive the scope of work and budget prior to the release of those contracts, and some of the contracts come in very late in the month, which is part of the reason why June is such a heavy contract approval.
As long as the contract is anticipated to be received before the beginning of June, we can go ahead and vote on it?
Yes.
Okay.
Yes,
All
and
right.
at this point, that is why our FEP and CRI contracts were removed, because we do not anticipate receiving those.
Okay.
So they were removed from this month. All of these, we should be able to execute and have in place by July 1, which is
Okay.
why they're agendized today.
All right, thank you.
And we did receive communication from the state health department that we would, they assured us that we would receive this contract by July 1. They were just experiencing some delays.
Okay, and Dr. Vu?
Deja, thank you. I just have a curious question for the tobacco education under 13.1 grants goals. Do we know what our current percentage is? Or does CDPHE know what the current percentage is? Looks like the goal percentage is below 15% for 2023. I'm sorry, for 2030. 2030, yeah.
So just to ensure that I understand your question, you're on number 13, point number 1. The goal is by 2030 to reduce the prevalence of any tobacco product use, including e-cigarettes for youth and young adults aged 24 and below, to 15%.
Correct.
I don't want to give you inaccurate information, but I feel like we're like right
Just
there.
approximately 50%, 80%, 25%.
Oh, much lower. We've actually seen with all-time state high, and Daisha, please join in if you happen to know this information off top of your head. There was an all-time high in like 2015 to 2017. It was nearly 50% of all middle and high school students had at least tried vapes. At this point in 2020, we don't have 2023 Healthy Kids Colorado data yet. So 2021, that number, I believe, is right there between 15 to 20%. I want to say 16%.
Yeah.
So we have made incredible, substantial
So it's
progress
declining.
in that decline. Exactly what has led to that decline,
Perfect.
a little ambiguous there.
Okay, thank you. We should keep going. Thank you.
And I will look into that, and if there is a significant difference of that 16%, we will follow up.
Okay, thank you. I'm just curious, but that's encouraging to hear.
Yes.
Our practice, we have a pediatrics portion of our practice, so this is important to me.
Yeah.
Okay, and I believe, good morning to Commissioner Applegate, and Corey, I think you have a question.
Yeah, so we've had this program like from previous years. Are we seeing a decline in the numbers? Are we seeing like numbers that are supporting this, that underage use is going down in the community?
Yes, absolutely. So this program began in one form or another, we believe in 1999 or 2000, under master settlement funds, and then seen a little bit of transition in that the funding sources. But yes, for many, many years, along with the, national trends, we saw combustible tobacco use decrease with the initiation of vapes, especially among young people. We saw that number begin to rise again in the early 2010s. And again, I think that peak was right around that 2015 to 2017 year range. And since then, we've started to see that taper off as well. And meanwhile, adult combustible tobacco use rate has also continued to decline. So again, vapes changed our landscape a little bit as they gained popularity. But I think as a state, we're, finding new ways to educate and, and prevent usage around the young people.
Can I also
And I
have,
would just add, I think we're definitely trending in the right direction. I think one of the most encouraging things for me was in 2017, we asked, through the Healthy Kids Colorado survey, but we asked kids if they felt like traditional tobacco, cigarettes was unsafe. Overwhelmingly, kids felt like it was an unsafe product. We asked kids, do you think vaping is unsafe? Only, it was much lower, like 46%. And don't quote me on that because I don't recall it exactly, but much lower. So kids didn't think it was as harmful as traditional products. But then 2 years later, after, multiple, statewide, local efforts, reaching out to schools, working, educating the community, raising awareness about vaping, that number drastically increased by 2019. And it jumped up to 70 plus percent of kids in our community felt that vaping was unsafe. And so I feel like that's a place where we have to start, is people got to believe that it's unsafe before we can start really changing behaviors. And so that was a big thing that I noticed.
thank you. That's encouraging to hear, and praise God. Can I have another comment? This is a somewhat sizable program. Funding is about $1 million per year, but I really think the return on investment for that is very high, especially because it's difficult to quantify the benefits of the program. I mean, there's so many diseases that we can prevent in the future that we cannot measure now. So, thank you.
Thank you.
Okay, thank you, Dr. Vu. That looks like maybe all the questions that we had. And that is the fourth one, A through D. So with that, I would entertain a motion and a second, and then if there's any further discussion, and then perhaps we could vote on those first four.
Motion.
Okay, motion from Dr. Vu.
I'll second if I could also just make a comment.
Absolutely.
Again, I really
Second from
appreciate
Commissioner
the
Geithner.
additional attention to outcomes and asking these questions. My hope, and I know what a huge undertaking this is because we've had a huge shift at the county over the last few years and really making good, strong data-driven decisions that the folks who sit in these seats get to see that. And so I really appreciate that. And my hope is that as we get further into this and even next year, and I know you're just the interim director right now, so we can't put too much on your plate until we get that whole situation settled. But my hope is that when we do these presentations in the future, to the questions that were asked around those outcomes, and I really appreciate the links, but for the public awareness as well, to even have that graph of here's where we were. We also understand that there's a lot of combined efforts. It's hard to pinpoint one effort, but I think even showing the data visually is really helpful for us, but also the public if they are tuning in or wanting to understand. So with that, I will happily second it, and thank you for your work.
Okay, thank you, Commissioner Geithner. If there is no other discussion, then I would ask all those in favor, please say aye.
Aye. Aye.
Any opposed? Then that passed unanimously. Okay, thank you. And we'll move on to the next contract. I'll let you go ahead, Deanne.
Thank you. And our next contract is the Fountain Valley Communities That Care. And again, our Community Health Promotion Division Director, Daisha Hudson.
Yes, so this contract is our Communities That Care, which uses an evidence-based model, the shared risk and protective factor approach to substance misuse prevention in the Fountain Valley area. Again, this is a year 5 of a current 5-year funding cycle. You will see that we are experiencing a 31% funding decrease. This is due to a reduction in the state marijuana tax cash fund. So there was a reduction at the state level that is then, is handed down to the local grantees as well. However, we were able to maintain or retain all of our FTE with our, as you can imagine, this is all substance use prevention. So we have our drug-free communities grant, we have our tobacco prevention grant, and then we have our communities that care. And so among those 3 grants, we were able to retain all of our FTE, and then none of the deliverables with this funding are going to change, even with the reduction. The program goals are to build capacity among coalition members in the Fountain Valley area. Fountain Valley was chosen for this funding originally because of their readiness to implement evidence-based strategies into the community to protect youth. Their 3 main goals are to decrease the availability of substances within the community, improve economic stability, and strengthen community connections for young people. As you can see on the slide, we've linked to a study that was done to really show some long-term program outcomes, but I wanted to give you some of our local program outcomes that we expect to see based off the evidence-based strategies that we're implementing, and that's to really see a reduction of substance use and substances in the community. Since this grant was implemented, the program has collected over 1,000 pounds of unused medication from the community. And then really wanting to support community involvement for youth. So helping youth feel connected to their community, to businesses and nonprofits and different activities in their community to help, keep them away from bad behaviors, substance use. And so they do that by, providing information, resources, training to the coalition members so that they can take that out into the community as well. So trying to build their skills for the community. Any questions about the Fountain Valley communities that care?
And if I could just offer one more element regarding this, as noted at the beginning, the reduction in funding, one of the things we are trying to do during this period is look for internal efficiencies where we can to help facilitate our programs. So previously, our tobacco education and prevention program, along with CTC, were really quite separate. Although they address very similar activities around protective factors for youth, substance use prevention. We have combined these programs together under one division manager at this time as a way to streamline those services and help be more efficient in the funding that we receive. So as we're talking about potential decreases or changing funding streams, this is part of what we are doing when we look internally about how we can deliver these program areas more effectively and efficiently.
Okay, thank you. Questions? Yes, Commissioner Geithner.
I really appreciate that. I think interestingly, and I just don't know who is aware of what, but we're seeing a decrease in marijuana revenue right across the state, and that's not a bad thing. So I think that this is something that is potentially going to continue to come. But obviously, Deanne, you sit as a non-voting member on the Opioid Council as well, and are aware, and I don't know if the rest of the board is aware of some of the efforts also in this youth prevention area that I think will complement what you're doing here, and whether you guys have talked about whether any of this programming is, whether there's any talk about you guys applying directly for that type of funding. Is everyone familiar with the Opioid Council and the work that's happening there?
If you want to give us a minute.
Yeah, if you don't mind, sorry, but I think it's so valuable for everyone to understand that work. So the Opioid Council is dealing with the settlement dollars from the opioid epidemic. States got involved in lawsuits against a lot of the pharmaceutical companies that were, according to the lawsuit, kind of complicit and pushing out a lot of opioids that led to a lot of addiction, and the opioid crisis, right, is kind of the concept that is here. And so the Opioid Council, the state is broken up into regions to distribute that money. And so that's the Opioid Council's function. So there are representatives from all over. I sit on that board. I think the city has, Line Weber is now on that board. So we have, it's a 14-member board. We have first responders. We have all kinds of folks all over. But anyway, so there's a lot of funding that can be utilized from the Opioid Council, several $1 million going to youth prevention, specifically around opioids. But as we all know, there's connection. And so we specifically asked for some RFPs recently related to youth prevention and connecting the dots between marijuana use and opioid use, because the crossover is very significant, and the data bears out that if you start using marijuana as a teenager, there's a very good chance that you're going to end up down the opioid road. Maybe it's even, I don't know if that would be valuable at all for this group to hear more about that work so that they're aware. But anyway, just, I don't know if you guys are looking at kind of how those two could work together, or even applying specifically for some of those funds.
And I would just say that, yes, we have had some initial conversations about that and look forward to opportunities with that. We currently have some of our team members engaged in work with Colorado State University and Teller County on some efforts, and look forward to building on that.
Okay, and thank you for that summary, Carrie. Other questions from board members on this contract? If not, I would ask for a motion and a second to approve this contract. And don't be bashful, anybody can do it.
So moved.
Okay, so moved by Commissioner Geithner.
I'll second.
And second by Hunter, Board Member Hunter Barnett. So thank you for that. All those in favor, please say aye.
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 Any opposed? Good job. Thank you for the presentations.
Thank
Okay,
you.
why don't you go ahead and go to the next one, Deanne.
Appreciate that. Next, we have our environmental health team and division director, Kat McGarvey.
I love environmental health.
Good, I'm glad.
This is the good stuff.
Good morning, board. I am Kat McGarvey, the Environmental Health Division Director. I also have behind me Sammy Jo Lawson, the Division Manager responsible for the Retail Food Program, and Meredith Lockwood, the Division Manager for Body Art Childcare and Schools Program and Vector Programs as well. Both have a component in overseeing the retail food, childcare, and schools programs that we offer here. Contract name is EH Health and Sustainability. We are currently in year 5 of a 5-year funding cycle. There is no change to our funding from last year to this year. The important note on this contract is that this is intended to be in addition to the fees that we also collect for the establishments and/or inspections in these programs. So this is intended to support data sharing between us and the state or CDPHE, as well as assign regulatory authority and delegation for us to conduct these inspections. The goals of the program are to ensure that we do conduct the required amount of inspections, ensuring compliance with the regulations that are enforced for each of the programs as well. Questions on that?
Any questions from board members? Kat, I have to say that the retail food folks are the most popular and almost like movie stars here in Colorado Springs. One of the local channels always highlights which restaurants got.
It is quite the segment on the news right now,
Yeah.
but we do have a phenomenal team that is handling that
What
very
you
well.
do makes the news with that, for sure. So if there are no questions, and we do have, several other contracts in the director's report, then we have our closed executive session. So with that, I would ask for a motion for the retail food, child care, schools contract.
So moved.
Thank you.
Second.
Okay, so moved and seconded by our county commissioners. And with that, all those in favor, please say aye.
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 Any opposed? Okay, that was an easy one for you, Kat. Let's see how it goes on.
Perfect. I got one more for
G.
you. And I failed to mention that Meredith Lockwood also is responsible for a waste hire program as well. So this particular contract is a statutorily required under the Solid Waste Act and regulations. This contract does provide sustained funding, so at the same amount as last year, currently in the year 5 of the 5-year funding cycle for that as well. This contract is intended to reimburse, words are hard, the actual activities that are conducted under that contract. Meredith does a phenomenal job of monitoring that and making sure that we conduct what we need to receive the reimbursement for that and not go over in that aspect as well. The important aspects of this, or the program goals, is to ensure that we reduce waste hire sites, thereby reducing potential for vector-borne illnesses and or hazardous waste disposal from events like fires and things like that when tires could possibly catch on fire as well.
Okay. Anything else on that one?
That is it.
Okay. Board members, questions after reviewing that contract? Okay. Sounds like everybody's, well, there are no questions. I won't try to be too funny today. Let's see. Could I have a motion to approve it?
So moved.
I appreciate that, Carrie. You're doing more than your fair share this morning. Any seconds? Could I get a second?
Second. Oh.
All right, I got 2
That's all good,
seconds. Well, I'm going to go with Mr. Barnett as the second. All those in favor, please say aye.
Aye.
Any opposed? And Kat, you know, there's multiple reasons to get rid of the tires and not have these things laying around, but mosquito-borne illnesses, that is a problem. And even in our county, our dry El Paso County, it's not dry enough that we don't have certain ones. So I guess we don't have time to get into it. But back in my old days when I sat over there, I would ask questions about that. So, okay, thank you.
Yeah,
Thanks
absolutely.
a lot. So, all right. Why don't you go ahead and guide us, Deanne.
Thank you. And next, we have our Clinical Services Division and Division Director Summer South.
All right, good morning. All right, so I'm Summer South, Clinical Services Division Director. And we've got Kara up here. She is our Division Manager for Nurse-Family Partnership. The contract we have before you today is our Nurse Home Visitor Program. Year 1 of 1, so this is an annual renewal, unlike a lot of our other grants, which tend to flow in cycles. This one is renewed every single year and presented as a new contract every year. So key updates, a slight increase from fiscal year 24 to 25. As you can see, that increase is due to a 0.25 of an already existing FTE. So we're not bringing somebody additional on board. It's just Nurse Family Partnership grant is covering an additional 0.25 of that. That is to cover the increased usage of our community health liaison position within the Nurse Family Partnership program. Next slide. All right, so looking at program outcomes, as you can see, our Nurse Family Partnership, it's rigorously evaluated, and it has been so over several decades. There's lots of research out there, and the NFP program has demonstrated significant reductions in child abuse and neglect, reduction of 48%, language delays at the age of 3 by 50%, and then a 59% reduction in arrests of kids by the age of 18. There's a multitude of other benefits. It's highly researched. We have the link here. There's lots of great data, but I really felt like these particular data points really stood out and have stood the test of time with the implementation of this program over the decades. So, do you have any questions?
Let's see. Any questions? Okay, we'll go questions first, but I don't see anyone else. So, Commissioner Geithner, I believe you have a comment.
I actually would say thank you for this work. Knowing what the role that DHS plays and how this is so related, and doing what I need to do as part of the child fatality review, it's always really sad to see the cases where we feel like support for families could be really helpful, and I know that this program is a big part of that prevention. Always difficult to calculate those things, but also really grateful because it not only fiscally helps the county and DHS and those things, but obviously the really heart-tugging things where we see families that just need support, and it's just really valuable, so thank you.
Thank you so much.
Yeah, thank you for those comments, Commissioner Geithner. Anyone else with a question or comment? If not, we'll just move to a motion and a second if we're ready for that.
So moved.
Okay, motion by Vice President Ralston.
I'll second.
And a second by Commissioner Geithner. All those in favor, please say aye.
Aye.
Any opposed? Okay, unanimous again. And we'll move now to, well, I'll let you go.
Next,
Deanne.
we have our tuberculosis prevention and control. Again, clinical services.
And we have Aaron Huser joining us up here. He is our program supervisor, or I'm sorry, program manager for our tuberculosis program. So the contract you have before you today is our TB prevention and control. We're in year 3 of 5 in this cycle. Some of the key updates: funding was reduced from $90,000 to $75,000. This is due to anticipated federal cuts. I did want to note that this is our first reduction in funding in several years. However, with that, the good news is that this award amount still exceeds CDPHE's funding formula. So obviously, in the packet for TB, that's page 60 of the informational packets that we had sent out. There's a little bit of commentary on the funding formula, and with the funding formula, we would be receiving fewer funds, but CDPHE has recognized the incredible work of our TB program, and so has continued to fund us over the amount, and it is greatly appreciated. This reduction is not fun for anyone. However, it is still above and beyond, and so we're pretty happy about that. There we go. And to speak to some of the program outcomes, so the TB prevention and control remains a statutory requirement. We have that listed here. The intent of the program is to diagnose, treat, and document any new TB cases in EpiTrax. That's our data gathering platform. And then to also provide appropriate treatment for latent TB infections, also called LTBI, as well as the active TB cases. So those are our requirements within this statutory requirement. Any questions?
And looking around, yes, so Vice President Ralston.
So there are anticipated federal cuts. So if the cuts don't actually happen, do you think you'll receive some additional dollars?
That's possible. So essentially, they had us leave our PO open this year just in case additional funds came in, which was not the case, but it could be possible, yeah.
And that would more than likely look like, supplementary funding later on within the year that comes down, I would imagine, as an option letter, but I don't want to speak too directly to that, yeah.
Dr. Vu, did you have something? No.
Yes, thank you. So I'm seeing that in 2024, there are 19 latent tuberculosis that were treated, of which 12 were new, and 8 were active. I think 3 of 8 were newly diagnosed. In my mind, that's a lot, but I don't know. Can you remind me the previous year data?
Sure. We usually go between about 4 and 8 active TB cases in a given year. So 4 to 8 is pretty typical. So this would have been a pretty typical year as far as the amount of active tuberculosis cases. So we also assist on a lot of cases of latent tuberculosis that are not treated by us. So we do a lot of consultation, and sometimes during our consultations, we'll actually take some of those patients if they're more complicated, for instance. So.
Okay, thank you. Would you, not exact, but have remember the epidemiology of the active cases?
Can you be more specific? Sorry.
Demographics of the active cases. Thank you.
Demographic. It kind of depends. Do you mean like
what kind of patients?
Oh, well, they can
homeless,
be
etc.
Oh, okay. So you're really looking at, it could be anybody. So if you're exposed, you could have an active infection. We've had people all the way from just since I've been in TB. From 2 to 88 or so years old, and these are people that are, American citizens, recent immigrants. They could be, really anybody, to be perfectly honest. We don't have like a particular type of patient. I know that may be kind of, there's just not necessarily something that I've noticed that's consistent with that.
Should we try to look for a trend? I mean, for medical school, I mean, there's tuberculosis patients. There's a specific, homelessness is, I think, one of the more one of the risk factors, stuff like that.
Yeah, and that's typically when we look at the risk factors, it's going to be risk factors for infection. So only about 10% of those people with an infection are going to end up with TB disease. We do, there are some populations that are a higher likelihood of having the infection. And I guess I'm really only speaking kind of like to my personal experience in TB. I haven't necessarily seen like a strong trend, but that's something I can look at if you're interested in national data, or I could look at our people over the last couple of years here as well.
And one comment I wanted to make towards that is, you know, the tuberculosis prevention and control grant that we receive and the funding that we receive for it, we receive these funds to implement the program that lives at the state level. So while I appreciate the question and totally understand, like, what are we looking at? How are we kind of going after some of our high priority areas and things like that? That is more a question for the tuberculosis folks at the state level. Where are they looking at? What are their trends? Are they tracking demographics? While the money and the funding that is sent down to us is to implement said program and to be that subject matter expertise, or experts, I'm sorry, within El Paso County to treat active latent tuberculosis and those kinds of things.
Yeah. Thank you. I do understand that completely, and I appreciate that. However, in addition to that, if there's only 8 cases of active TB in the year, I mean, it's, you know, half of them have certain certain risk factors for us.
Sure.
No, thank you.
Absolutely.
Yeah, I'll take a look at that.
And we have talked about this before in the past. And so, you know, today's business is to decide whether or not to renew this contract. But perhaps in the next few months, Deanne, we could get just a presentation on TB in the state of Colorado, and even a national thing, because that question has come up in the past. And it's a very practical question. Who has the active cases? What is common among them, if anything? Or is it one of 8 different groups? But I think it's a reasonable request, so I support that. And is that something we could do?
We'd be happy to come back with
Okay.
additional information regarding TB and also share a little bit about the complexity of the follow-up that Aaron and his team do with these clients, because 8 may not sound like a particularly large number, but the follow-up is quite extensive, and they work with these clients over a long period of time, and we'd be happy to share more about that in the future.
That's great.
Thank you.
Definitely.
Okay. And with that, if there are no other questions or comments, there is one. Go ahead, Karen.
Yeah, so just on this, I think it's a really important kind of topic, because I completely understand this is a state-run program. Here we are, we're asked on this, and it makes sense to me to approve this contract today. However, no one's going to be surprised probably in this room to hear me say I don't have a lot of confidence all the time in the state, and so I think that it is really important for us to evaluate that on a local level. Accept the grant, let's evaluate it, but there are ways to influence and bring forward concerns that we might have as El Paso County, obviously both through this board. As Deanne mentioned, we have a government affairs team that works on various different things as things come forward in the state legislature. I know in the same way, Councilmember Donaldson, President Donaldson, I guess I'm not sure which you prefer in this setting, probably does some of that work as well, obviously, Commissioner Applegate. So many of us are engaged in those state level conversations, so I think that is still valuable information for us to evaluate. So that as policymakers, that we can, if we say, hey, this is actually not what we need, you're telling us this is the program that we have to have, but is it the right program that we need? And if there are things that we need to be advocating for out there. I know Stan Vanderwerf was previously on the state health board, and he actually did get to speak into some of those things. I honestly don't know if that terminated with his, I don't know if it was contingent upon his being a commissioner, but it's just something to be aware of, that we do have those avenues, so it's important for us to have those discussions here, in my opinion.
Sure.
Okay, thank you.
Can I have another
Yes,
comment
Dr.
on
Vu.
that? Thank you, Carrie.
Second
I do
shot.
understand some of these programs, deliverables, some of these programs, we are not asked to track data as part of the deliverables. I understand that, and our deliverables are just to carry on the actions. and tracking data is at the state level. However, there's several $1 million coming to our budget from the county, and if the county is asking for data, I think it's a fair ask also. So it's a balance.
Absolutely.
All right. Anything else before we go to a motion on this? Okay, looks like questions have been and comments have concluded. Could I have a motion and a second for the tuberculosis prevention and control?
Contract.
Okay, thank you, Dr. Chan, and a second.
Second.
And a second from Dr. Vu. Thank you, Dr. Vu. All those in favor, please say aye.
Aye.
Any opposed? Eric, thank you.
Thanks, Aaron. Appreciate it.
And we can move to the next one, Deanne.
All right.
Or some.
Congenital syphilis prevention. We have Jamie Morris joining us. She is the Reproductive Health Clinic Division Manager. She oversees the congenital syphilis prevention program that is able to function as a result of having the Reproductive Health Clinic, which is great. So the contract before you, another term used for this is the Detention Center STI Screening Program. We are in year 3 of 3 with a possible extension of 2 additional years if funding allows. Some of our key updates, roughly $8,000 reduction in funding from fiscal year 24-25 to 25-26. And then the addition of certain activities that would be field-delivered therapy program and some additional community outreach and education was added into the deliverables for this particular grant. Next slide, please. And just to speak to some of the program outcomes, first I wanted to highlight the fact that this program is aligned with the CDC's sexually transmitted infection treatment guidelines, as well as the U.S. Prevention Services Task Force recommendations, which include supporting screening in correctional settings, which is where this program is housed. In Colorado, just for some trends and data that sit behind this program, we had a threefold increase in overall syphilis cases from 2018 to 2023, 7 times increase in congenital syphilis, so 50 cases in 2023, and then a 28% of congenital syphilis cases were acquired during their pregnancy. And then I wanted to get a little bit more granular. El Paso County data from 2018 to 2023, we saw a rise of congenital syphilis cases from 1 in 2018 to 9. That's an 800% increase. All syphilis cases went from 92 to 264. And then in the particular world of women of reproductive age, went from 12 to 57 cases. That's nearly 5 times the amount. And the reason we highlighted the reproductive age is because this particular grant is geared towards women of reproductive age in the correctional setting. And so basically the implications of this data and the supporting bodies is that the data supports expansion, expanded testing, routine screening, and then especially specifically in correctional and high-risk settings. Do you have any questions?
Yeah, I have a question.
Dr. Chan.
I don't understand how only 28% of congenital cases can be acquired during pregnancy. How else would you be able to acquire congenital syphilis?
So that's a great question. Sometimes people have the syphilis prior to pregnancy, and so we're talking about people
the mother
who are pregnant and then get syphilis.
Oh, so you're not talking about the
baby.
Oh, so the 28% of congenital cases, the mother acquired syphilis during pregnancy.
Well, the baby, yes, and
but you
therefore
knew
the baby.
that the mother did not have syphilis prior to the pregnancy.
Yes, and so we look at that through a sexual health assessment that is very specific and rigorous, and then, of course, working with medical direction on the staging, et cetera, of where people are at. So no known prior syphilis, and then...
So you're saying that 28% of congenital cases, the mother had primary syphilis, whereas
they acquired it.
In
yes.
the other cases, the mother had secondaries.
Yes.
Or even tertiary.
Secondary or unknown duration.
Unknown duration, yeah.
Okay. The other question I have is, are the cases or all the patients that you see in the incarcerated setting that this grant supports, are they counted in the reproductive health clinic visits?
They are not counted in the reproductive health clinic visits. They're two separate programs. So we have a criminal justice center program where all of that data is captured. And then we have our separate reproductive health clinic that operates like the Title X.
Okay,
Yeah.
okay.
So they're two separate programs.
Okay.
Hunter first. Board Member Barnett.
Real quick, a couple questions. So these are all increasing, kind of going in the wrong direction. So is that because we're getting better at testing, or is there something underlying in the mix of individuals coming in
So
to the
this was
detention
like-
centers that increase the risk of catching them?
Okay, this was kind of to paint the story as to when this program developed, because this program we initiated screening December of 2023. So this is kind of showing the rise of the cases from then. And then we have more recent data that we will give you here shortly, just to show you kind of what we've done in this program in the last 18 months.
And then one suggestion when you do that, it would be great to see like a per capita or per 1,000 individuals, because 3x increase in the absolute number, if you contextualize it within like a per 1,000 or per 100 incarcerated persons, you could actually see that rate decreasing, which is what you would want to see.
What we want to see,
Yeah.
right.
So it would be helpful to have that next time.
Yes, sir. Thank you.
Yep.
Okay, thank you, Hunter. And Commissioner Geithner.
Yeah, so this one is really interesting to me because, of course, there's medical care at the jail, and they are required to provide for all the medical needs of folks in the jail. So the questions that I have around this are we duplicating a service? Because the county is already paying a lot of money on a medical contract. And so is your thought that this would not be being handled if this program didn't exist, even though every single person that is in our jail is entitled to that appropriate medical care?
So let me try and field that for you. The hope is that when these individuals go through that system, that they receive the very specific STI testing and screening, et cetera, upon intake. One of the complications that lives within that is the rapid turnaround, the backlog of processing individuals, STI testing, which, when they're in processing, is based on, hey, if they have symptoms, they can raise their hand and say, hey, I need testing for X, Y, and Z. The program that we're implementing is a much more proactive approach with the individuals. And so I think it's less about duplicative services and more about a synergistic effect in trying to capture these individuals who are coming through the system. I don't want to speak to their medical care or their system or how they're running the show, but with the addition of our nurses and that are dedicated to this specific work, I feel like we are able to come alongside and provide a more proactive approach and catch more individuals. The proactivity is not a requirement, although testing is, but people have to say, hey, I have symptoms. And this way, with the pregnancy testing, so we're identifying pregnant individuals, and then early rapid detection of syphilis. We have a combo test that is rapid syphilis HIV testing, which they don't necessarily have to use, and maybe through whatever funding, whatever supplies that they receive, they don't do that particular. And so for us, it's almost immediate. And then we have dedicated staff to provide same-day treatment. And it's just a much more effective way to manage these STIs as they come through this system.
The process in which it occurs, for patients that are outside of our program, because of just the general flow of how things go with the medical care there, they're prioritizing emergency situations. STI screening may not be a priority. And so there's a much further gap in between doing the lab work, identifying a positive case, and doing the treatment. And a lot of them are lost to follow-up, where in our program we get a 96% completion of therapy rate, and we're doing that same-day treatment, which is huge in this population, just because of how quickly they can be released. There's times where, we have a patient on the list to screen them tomorrow morning, and they're gone before we can even get there. So they get released pretty quickly from CJC.
Yeah, I'll just say this one is still a little bit harder for me in terms of really feeling the outcomes and, population data and all of those things. However, I'm fine with voting for it today, but it's one that I just continue to go, is this really the best use of taxpayer funds when it does seem that, again, they have the option to get help. I'm not sure that the government should be in the business of tracking people down to make sure that they take care of their own health. It's just something that philosophically I struggle with a bit. When they have options, we have the ability to do those things. So again, I'm gonna vote in favor of this today because I know that you haven't had a lot of time with the program yet, but this is one that I will want to watch and ask some really hard questions about. When we're talking about funding cuts and we're seeing these things, the state is overspending dramatically. We really have to talk about priorities, and that's not always. Here we're always talking about what just happens here, but I like to think about things from the large level because that's what happens at the state and the federal level. So this is just one I want to watch really closely on. Is this the best use, the highest use of those taxpayer dollars, and also is it really fitting in with the top priorities that we should be tackling for the most good for our community?
Dr. Vu.
Thank you, Carrie. I actually do agree with Carrie on that one. I think our aspect of healthcare should be proactive. I do agree. I'm not saying that we should decrease the preventive measures, the preventive aspect of the program, but I do think that the contracted healthcare that we are providing to the facility should include the aspect of prevention and proactiveness. Thank you.
Dr. Chan.
Yes, I have a comment on that as well. I understand the priorities in the incarcerated population when it comes to medical care, as you said, emergencies, active infections, trauma or injuries. And I don't think that it's reasonable for people to go to jail and get a mammogram. That's not part of the medical care that needs to be provided. And so I do see the utility of this contract in seeking out asymptomatic disease that has a very expensive, very long-term consequence if it's not treated. I don't know if anybody here has seen congenital syphilis. I have. It is a lifelong disability. And so there's no question that preventing one case is worth the investment. The other thing is that, many diseases become symptomatic at some point. Syphilis does, but usually it's not the type of symptoms where somebody might seek care. And it can masquerade as many, many other diseases. I'm sure that everybody knows that traditionally dermatology and syphilis used to be in the same department as a subset of internal medicine because it is the great imitator. And so I think that this program is very important, even though it looks like there are very few cases. The implications, though, of those cases, the cost and the lifelong disability, and then the taxpayer dollars that have to go into supporting the results of those cases is much, much, much better prevented, I think. So I support this contract.
Thank you, Dr. Chan.
Thank you. And I did want to speak to that idea of, while I'm not going to give any kind of personal opinion on, the idea of tracking people down to get care when they have certain things offered to them, because I fully understand that. However, the real effect is on these babies, right? And the long-term negative consequences, they did not choose the situation in which they are being born to. And then, if you take a look at that population that is in and out of the jail, the correctional facilities system, oftentimes are not the ones that have the private insurance and that are going to, seek medical care and can provide the dollars that are a result of congenital syphilis cases. That burden is on the community and the taxpayers. And so these prevention efforts, I also feel, obviously, I'm very much in support of the utilization of our team to help prevent even one single case. So thank you, Dr. Chan, and I appreciate the questions. I really do.
And I think if it's, something that I have recently discovered in this program, which Commissioner Barnett, this might be helpful for you, is looking at the most recent 12 months of data, so May 1st from 2024 to April 30th of 2025, there were 58 cases of syphilis in women of reproductive age. This program, and that was here in El Paso County, this program specifically caught and diagnosed 23 of those, so that's 40%. So 40% of these syphilis cases for women of reproductive age in El Paso County were caught in this program specifically.
Dr. Vu.
So I appreciate that. I do agree. I do appreciate that, and I agree with the effort that we're putting in. But the real question is, why is it us that have to catch it? Why aren't they catching it? Why aren't the contracted healthcare providers there catching them? Right.
I mean, that is a great question.
Correct.
And, if I had the magic 8 ball and the means to fix that
Exactly.
system, I think that would be the
That's
answer,
whole
right?
point of the question.
Yeah. Understood.
I think that if this program proves the utility of this type of screening upon intake, that it may become more of a protocol that the medical care contract uses.
That's the goal.
But I think that, you have to have some kind of proof of concept before you mandate that as part of the health care for somebody coming into the system.
Absolutely, and that is the goal, the transition of this into our community partners' hands so that they can better identify and then we can shift our focus elsewhere.
Because we're also providing, educational opportunities for the medical staff inside CJC. We've done syphilis presentations for them to help with lab interpretation, to help with treatment, to understand adequate treatment, because a lot of times people may not adequately treat. They may only give a patient 1 dose of bicillin when they actually need 3. Staging can be difficult sometimes, so we've provided education to the medical staff inside as well, kind of gearing them up towards taking over. I don't think that this was ever an intention of this program to do this full-time forever. It was, to eventually go back on the responsibility of the medical provider inside.
Great questions and presentation. But I believe if that was to happen and this was to go to the medical provider for the jail, they'll want additional funding for that because they're going to have additional costs to do this. They might even need to hire, an additional provider depending on how many cases there are, et cetera. So looking at it just financially, when it moves over, I'm afraid for the county commissioners, that contract, they're probably going to ask for a little more on it. So, but with that, if there aren't any other questions or comments, that was a good exploration of this one. I would ask for a motion to approve this contract.
I'll move to approve the syphilis contract.
I second the motion.
Okay, so a motion by Dr. Chan and a second by Vice President Ralston. All those in favor, please say aye.
Aye.
Any opposed? Okay, so unanimous also. And we will move to our last contract. Jamie, are you part of this one too?
This is also me, yes, sir.
Okay, and so with that one, I'll hand it to Deanne, but I think she's going to hand it right to you.
Yeah. All right, thank you so much. Okay, so what you have before you today is our Title X family planning contract. This is year 1 of 5 of the 11th consecutive 5-year renewal cycle. Some of our key updates, funding has decreased from fiscal year 24-25 to 25-26. This decrease in funding from previous years is due to a reduction in the funding for the Title X program at the federal level. So we just get less funding when there is fewer funds to give out. Next slide, please. All right. There we go. Okay. So some of the program outcomes, I wanted to speak to a initiative that was launched. So the Colorado Family Planning Initiative launched in 2009, an initiative that funded the expansion of Title X clinics' access to long-acting reversible contraceptive, which is a mainstay for Title X services that prevent unintended pregnancies. So This was implemented in 28 Title X agencies across 37 counties in Colorado, serving low-income women. The initiative included provider training, clinic support, and financial coverage for the LARC method, so that's that long-acting reversible contraceptives. And so I wanted to speak to some of the cost savings that were a result of this. So the initiative resulted in approximately 66 to 70 million in avoided public spending over the 4 years that it was implemented. Social service costs, such as like Medicaid births, SNAP, TANF, all of these other social services, were implied through observed declines in the unintended pregnancies and high-risk births. Women, infants, children, so WIC enrollment for infants declined by 23% statewide from 2010 to 2013. And then there was a reduction in births, roughly 14 to 29% depending, which translated into fewer women and infants enrolling, leading to a reduced strain on public nutrition support services. The initiative not only improved health outcomes, but also saved public dollars, and also created a replicable model for fiscally responsible public health programming with their sustainability model, moving it from the initiative, which started with private funding, into other facets, other revenue streams to help support this increased LARC usage in Title X facilities.
Yes, question from Commissioner, Board Member Barnett.
Thank you. Do you have this data for El Paso County? I'm assuming this is for all 37 counties?
Yeah, no, I do not have the initiative's data just for El Paso County specifically. I don't.
You don't have it on you, or we don't have it at all?
We don't have it.
Okay.
I couldn't find El Paso County data specific broken down.
Another question real quick. So just so I'm clear, so how are these costs actually, cost savings, all the savings actually calculated? Is it as simple as this program of avoided, it all comes down to avoided pregnancies and births? Is that what this is? So
yes, and so for those avoided pregnancies that would have been unintended, and it's for low-income women, so these Title X facilities, so they are no longer needing to get on Medicaid, TANF, SNAP, and so I have the broken down numbers that is in this initiative, and we can send the links for all of this information. But for example, Medicaid, there was that resulted in 52.3 million worth of savings because we did not have them enrolling a Medicaid birth and all the dollars and cents that it costs to support that for these low-income individuals.
Gotcha.
As well as WIC and et cetera.
And then one last question. Presumably there would be fewer abortions. Have you looked into that? Is that part of this?
Yes, I didn't present that information here, but yes, it is.
It would be, I think, good to include that if you're able to quantify it.
I would be more than happy to, absolutely.
Great.
Okay, and Dr. Chen?
So this Title X, these funds is mostly what supports the reproductive health clinic activities, right?
Yes, it is a large portion of what supports the reproductive health clinic, yes.
Okay, so I seem to recall that the reproductive health clinic prior to the pandemic was seeing about 290 visits per month. And then I saw that shortly after coming out of the pandemic, it was pretty low, and then it went back up a little bit, but never achieved the pre-pandemic levels. And that it's looking like 2025, the number of visits are even lower. It's getting to the point where it's about half of the pre-pandemic levels. Is that what you have seen?
I mean, yes, as we track these visit numbers, as we move forward year by year, that is what we're seeing. There hasn't been the hoped for recovery after the pandemic and it shutting down to pre-pandemic numbers. We are working very diligently within the community to spread the word for family planning services for the reproductive health clinic. But yes, you are absolutely correct in seeing that.
And so for the people who are working in the reproductive health clinic, that is about half as busy as it was before. What's the story with the FTEs there?
Sure, that's a great question as well. So post-pandemic, so I came into the program, I was previously the division manager for Reproductive Health Clinic in 2021 when I came on board. And so I noticed the same thing and worked different avenues, but could see that there were positions being held, FTE, which require fringe, right, to be held to the side for these positions. And so we evaluated each position as they, we initially evaluated each position as they were and got rid of some of the ones that were on hold, understanding that we are not seeing that increase that we were hoping for. And then as we move forward year by year and positions come open, we are working with the rest of our leadership team to evaluate each of these positions and what makes sense for the clinic and any position within the agency, actually.
And so do you think that the drop in visits has something to do with either expansion of Medicaid, where people are now using their Medicaid coverage to see a private practitioner, or do you think that the expansion of just Obamacare, that more people are having insurance and seeing private practitioners, or do you have an explanation of why there's such a drop in the number of visits?
You know, I don't. I mean, this would all be just entirely speculation for me to say, yes, I think it's related to this. I will say that a lot of times our new clients that come in did not know about our services previously, didn't know that we existed, didn't know that it was available. So, you know, to some degree, is it a marketing issue? Is it a, you know, media campaign? And so that was where we focused have been focusing a lot of our efforts in community outreach. You know, and I will also say with the CJC program, the testing women of reproductive age at the jail, we have been embedding ourselves within the community and trying to get the word out there at a local level, and then also attending various events, you know, that are public facing.
Thank you.
Did you have one, Carrie? Okay. Vice President
So
Ralston.
under personnel, could you just provide some more insight into this? It says 5.85 FTE for 3.8 months. So I'm
yes.
guessing there's other funding for the rest of those months. I don't understand that when you're talking about personnel there.
Happy to explain. Yes, so the Title X dollars that we have, the entire amount supports that many FTE, which is our entire clinic, for approximately 3 months. And then after that, there are no more Title X funding. So we like to front load them, get everything paid for. The vast majority goes to personnel costs. And so this grant supports for approximately 3 months, and the rest is unsupported. So without those dollars, that's 3 months less of supporting those FTE.
So where do the other dollars come for the other month?
Sure. So it is a combination of revenue streams, which are broken out into Medicaid payment, the other third-party biller, clinic fees that we are able to collect. We do have an STI grant that runs on a totally different cycle than this, and that's a small portion that also helps support. And then I'm forgetting another revenue stream. Oh, and of course, our LPHA, you know, county funding.
Thank you.
Yes.
Okay. Commissioner
Oh, I am so sorry. Go ahead.
But if you had more to add, go ahead.
Not to that, but I will address this. I have the number for you that you were requesting regarding abortion rates for that study specifically. So.
This is a loaded topic. There's just so much here to unpack, and I'm going to kind of start with, you know, there's data, and then we make policies and we make decisions based on that, and there's all kinds of things here.
Sure.
I think this one is really interesting, and I'm looking at this saying a reduction in births. First of all, births are reducing across the United States, so and it's actually kind of a problem. So, I mean, there's actually a lot to unpack here, which is that actually truly a function of just what this is? The question about if people are not coming in, do they need this service? Is something the government has a big role in right now, or if they found other avenues. And I think those are really hard questions to answer, but they really are important questions for us to ask, because we have all kinds of different programs that have expanded, and if folks are getting this kind of treatment, whether through a nonprofit or through another government-funded source that is taking Medicaid and going out onto the private, that's a good thing to be happening if people are seeing that happen. So I know these are hard questions.
Sure.
But I think that they're really, really important to understand and try to understand. And maybe there will be some additional insight from the federal government as they're looking at programs. They're obviously looking at programs, asking hard questions, which is kind of a commentary that I'm going to have on all of this, which is, again, as an organization, some of these things may be difficult for us to grapple with how we right-size an organization when there are changes. It doesn't mean that the funding decisions are wrong. We have the federal government looking at the effect of a lot of these programs from the top down. I happen to know someone who worked in the federal government on HHS and has, there's tons of things that they are trying to make efficiencies on. And they can be very difficult things for us to grapple with. But the reduction in births translating to less services, that is a reality. I also think we have to be very careful. There were some statements made at the state legislature this last session, and I'm going to tell you they were about abortion access and how it would save the government money. We have to be really careful, in my opinion, about looking at anyone who has lower income. I came from a very low income family. So did my husband. And those programs exist for a reason. I'm full support of the safety net for families who need it, fall in hard times, whatever. I would never encourage, not for folks to have an abortion because they're poor. I would much rather have the community. But we also have to remember that it's not just a government function. The community has responsibilities to these folks as well. Just because someone is born into a low-income family does not mean that they are going to be a burden on the government. Lots of families figure that process out. They get a hand up and are able to trampoline themselves forward, and then they live wonderful, full, contributing lives. That's the goal of a lot of federal programs that we are seeing. That's what it's supposed to do. So even if people are in that, I just want to be careful, and I don't mean that in a it's very easy to read these, and we all care about statistics and say, great, it's saving us money, less kids being born. But wow, that's a real detriment to our economy, to our communities, to us as human beings and human flourishing, because I think being a parent is one of the most incredible things that you can do. And so I just wanted to kind of point that out, that while I understand why you are presenting these numbers to us, we also need to be very thoughtful about the other kind of components of this. And anyway, so those are my comments.
I think one thing
Thank
I'd like
you,
to
Commissioner
point out.
Geithner. And I'll just add this a little bit in there, and then it's going to be Dr. Chan's turn. Is none of the funds that we're talking about here today will be used for abortion. That's not part of this program.
I wasn't saying that.
And that's good. Just for people watching, they might not have as complete understanding as we do. That's not this. This is birth control, long lasting. Dr. Chan, please.
I think that one thing to point out is that when these social services were initially implemented in the early 60s or so, birth control options were somewhat limited. And then there were policies that made it difficult for women to access birth control. We have migrated to more of a thinking that it is family planning. And it's not just up to women to control their reproductive future. It's societal, it's partnerships, it's family. And now, with the options that are available, human reproduction is 100% under human control, and that wasn't true before. When we talk about falling birth rates and contributions to society, certainly there are people who use the safety net and springboard, like you did, to a very important contributing role. But then there are some people who are not able to make good choices, and it becomes generational, where their children are not taught how to make these good choices. And so you see the whole spectrum of people who need government support, cradle to grave. You have some people who use that springboard. That's why people come to this country, because there's tremendous opportunity here. But the difference is now we have 100% control of reproduction. So this kind of program, I think, is important in helping people get out of a cycle of poverty. if they have an unintended, unplanned pregnancy that requires government support, it also tends to hamstring them from advancing their own financial interests and their own economic contributions. And so I think this kind of program does help plenty of families and women control their reproduction, make it a choice and not a victim of their biology, so that at a time when they can afford to have a child who's going to be a contributing member of society, then they can have their family then. But I think it helps women who may have no other resources to control their reproduction, to control their reproduction.
Thank you. And I also wanted to say, too, that with the Title X, well, the Reproductive Health Clinic, but within Title X, we don't just provide birth control. We also provide counseling services. So if women want to do it naturally, they want to cycle track, if they want to, have some of that autonomy over different methods and have choice in that matter, we also have all of our staff trained in that sort of counseling and education on spacing births, what you can do to have the healthiest pregnancy outcomes should you want to. And to some degree, we do very, very basic fertility counseling, so helping people understand and get help for the initiation of pregnancy. We don't just prevent, we create healthy families, healthy pregnancies through that as well. So I just wanted to highlight that. It's not just birth control.
Commissioner Geithner.
I just want to, one more comment here. Again, I'm going to support this today. My comments are more around, we may see changes coming down in these type of programs. And also, those may all be good things. The question to me is always, is the government the right person to run the clinic? Are we seeing opportunities where other programs are sending those folks out into the private market of seeing those doctors and still getting those services? So just to be clear, I'm not saying they shouldn't receive those services. I'm sure you're all doing a wonderful job, but I think as the world changes, to your point about what access there are, and I'm going to say there's more access to that type of information today than there has ever been. I shudder to think about where some people might be getting the wrong information, but there are also very easy access to reputable organizations that can give that kind of counseling even online, right? So there's just all kinds of, that's really, not saying that there's not a value in these things, and I appreciate that. But I am saying we do have to ask the question of, if people are not coming, is the right thing to do to market and say, come to the government, or do we look back and do we say, actually, we've solved this problem in some other way, and maybe we don't need to be pushing ourselves as the provider of that information if we have solved the problem in our community. There's a hesitancy for the government to ever stop doing some things. And again, I'm not advocating we completely close this or anything like that, but I think if our patients are dwindling, and we are seeing that there are other avenues that people are being served by this, they're hard questions for us to ask and say, is this the right method going forward? And while we're trying to measure the value in this, are we measuring the value in a way that, again, is actually the right way to measure that value? So.
Okay, thank you, Commissioner Geithner. I think those are good points you make. Other comments or questions? I don't see any others. And so I would ask for a motion and a second for this contract. Okay, so moved by Board Member Barnett.
Second.
And seconded by Commissioner Applegate. All those in favor, please say aye.
Aye. Aye.
Any opposed? Okay, so thank you, Jamie and Summer. I'm not sure if you've got the next part in this too, Summer.
Still up here.
Okay, you're still up
I'm
here.
done.
Thank you, Jamie. Thank you. And
so
we'll
much.
now move on to our director's report.
All right. Here next to me is Christy Durbin. She is our division manager for the immunization clinic. And if you go to the next slide in the director's report, please. So we are presenting the immunization funding in the director's report. I'm not going to completely reiterate everything Deanne said, but just a recap is that this is not a renewal. It does not require signatures, and therefore it's not being presented with the other renewing contracts. So we are doing this separately. It's more of just an update and information for all of you today. So key updates. The contract will continue with state-only funding for right now. A federal funding option letter may arrive in July, maybe past July. We're not 100% sure. And then just a little information. Last year's federal amount was $278,355. So state funding last year, we have an increase from last year to this year. And then I could just speak a little bit to our program outcomes. So, yep, there we go. Yeah, same slide. So our goal, what we are required to do is to help reduce vaccine preventable disease by focusing on things like access, education, and alignment with national immunization standards. And within that context, we promote recommended vaccines, we offer vaccines to the public, and then we administer them according to the Advisory Committee on Immunization Practices, also known as ACIP, as well as the CDC guidelines. Any questions?
I do not. Board members, any questions on this topic? Nope, nope, nope. Yes, Commissioner Geithner.
Okay, this is a really interesting topic right now for everyone who's following the conversation around ACIP, and I'm just curious, I know there have already been some recommendation changes. What is your expectation on that? Do you see that affecting additional things that we are doing here?
Yeah, so we have started to see some of the changes with some of the recommendations. So we do follow those ACIP recommendations and help parents make informed decisions about vaccinating their children. We could foresee some of that impacting what insurance covers because insurance companies follow the recommendations of ACIP on what they cover. So we are looking at that, but we don't know exactly what it's going to look like in the future.
Okay, thank you for that information. Anything else, Carrie? Okay. And I don't see any other questions, so I'll look to Deanne, see what's next.
And briefly, we just wanted to provide 2 additional updates. Thank you, Summer and Christy.
Thank you.
Yeah, thank you.
We have received the Government Finance Officers Association Distinguished Budget Presentation Award. This award is for our budget book, and it's a significant achievement and reflects our commitment to meeting the highest principles of governmental budgeting. And in order to receive this award, we had to satisfy nationally recognized guidelines for effective budget presentation. So we're very happy to have that award. And I would just like to thank all of the team members who worked on that. These are lengthy documents that contain information that allows this document to provide historical record of our budgeting trends, speak to it from a policy perspective, a financial plan. We have performance measures that serve as operating guides, and it also communicates with clarity and comprehensive information our budget and funding streams. We do have copies of that for Board of Health team members if you would like to take one. As you exit, we have those by the sign-in roster as well. But also underpinning this, along with our audit presentation, just tremendous gratitude for all of the staff work that goes into making these types of awards possible, as well as the tremendous partnership with the Financial Services Department within El Paso County, because they work so closely with us on all of these elements. So very happy to share that. The other update that I want to run through quickly in the interest of time, I just wanted to let you board know that in partnership with the Colorado Department of Public Health and Environment, we hosted the 7th annual EPI conference, May 7th and 8th. This is an annual conference that's a unique partnership between state and local public health agencies, and it provides an opportunity to bring together epidemiologists from across the state and region for the opportunity to
to learn and build their skills together, including addressing a variety of areas that impact local public health. This particular iteration of this conference, we had 150 people attend in person, 130 joining us online. And I would like to thank, in the room with us, we have Haley Zachary, who is our division manager for communicable disease, as well as you saw Marini Klaber earlier. She has been an instrumental part of making this conference happen year after year. And I think the really wonderful thing about this is as local public health agencies, we are sometimes more confined in our opportunities for professional development. And this is really a wonderful setting in which we get the opportunity to highlight how local public health is practiced and implemented at the local level and raise awareness for that, bringing together other LPHA partners from across the state. So I wanted to highlight that and thank the team involved for making that possible. And in the interest of time, that's my rapid conclusion to the director's report.
Okay, thank you, Deanne, but yeah, go ahead, Board Member Barnett.
So my question, Deanne, I just have to ask,
Yeah.
on the staffing update, single-digit turnover, is that year-to-date? So can you explain just what's going on? Because
Yes.
it looks really good.
Yes, so our turnover has really stabilized quite a bit. Certainly in the years after the pandemic, public health experienced rapid turnover. That has slowed considerably as we kind of realign with more typical staffing for our agency. It continues to be something that we will watch closely. But as we discuss the funding changes, I expect that we'll still continue to be navigating staffing and sustainability of the agency.
Okay.
But it has been quite encouraging.
Great.
Deanne, what is our current staff turnover rate?
Give me a moment, I would have to, thank you, thank you. It's in the director's report, but yes, it is quite low at this stage, coming off of highs from the pandemic in which we had very rapid turnover.
So 5.7% over the last 12 months?
Lauren, would you mind speaking to that? Lauren put that together for us, year to date. So through,
So 5.something% over the last 6 months. What's benchmark?
Well, the national turnover is 46%.
Annual,
So-
perfect. Okay. Thank you.
Okay, are there any other questions for Deanne before we close out the director's report? All right, well, we'll call that closed. The director's report. Our next item is a closed executive session. And before we go to that, I want to thank the staff too. I wasn't here at the beginning, but I can tell the changes to those contracts and the presentation to the board of the contracts was well received and appreciated by board members. So I think it was a lot of work to do that, but it's helpful for board members to have a better understanding of the contract. So thank you for all the work on that. And with that, we will now move on. I'm going to hand it over to our attorney to help us go into closed executive session.
Thank you. Just to recap the process, I will read the executive session request into the record. Then we do need a motion to go into executive session, a second, and a vote. At that point, anyone who's not part of the executive session, so 98% of your staff is going to leave. I'm going to turn it over to Nate Whitney from my office to handle the legal aspect, and then you've got someone from Human Resources here as well. You will hold your your executive session. You're not allowed to make any decisions during that time, but you are allowed to give direction to staff if you choose to. Then you will come out of executive session and adjourn the public meeting. Unless there are any questions, I'll go ahead and read this into the record, and then we'll need a motion.
Okay. Thank you for that, Lori. And I'll just point out for the folks, if anyone's watching online, that after the executive session, when we come out of that, the only thing we'll do is adjourn. So there won't be any other action after that. I don't anticipate any. And with that, go ahead, Lori.
Executive session request pursuant to CRS 24-6402-4F to discuss personnel matters, specifically the recruitment of a public health director.
Okay. With that, we'll vote. So I'd ask for a motion and a second to go into executive session.
I move to
Closed
go
ex-
into executive session.
Closed executive session.
I second the motion.
Okay, so we had a motion by Dr. Chan and a second by Vice President Ralston to go into closed executive session to discuss the, how did you phrase it?
You can just say the matter on the record.
The matter on the record. And really, we should kind of do a roll call vote on this, but we'll just start over here. And Commissioner Applegate, yes, aye or nay?
Yes.
Okay, Commissioner Geithner's aye.
Aye.
Dr. Chan,
Aye.
Vice President Ralston.
Aye.
Board Member
Barnett.
Dr.
Aye.
Vu, and I also vote aye. So that's unanimous to go into closed executive session, and we'll prepare the room now for executive session.
Mr.
Yes.
President, might I request a quick break?
That is a fantastic idea,
Okay.
Board Member Barnett. So we'll take, because I know other people have things to do, just 5 minutes, okay, and then we'll be back.